So you've decided to come off of your antidepressant, but you're afraid of experiencing those nasty withdrawal symptoms that you've heard about. Well, in this video, I'm going to give you 3 strategies on how to avoid experiencing uncomfortable symptoms when stopping your medication. The first strategy I need you to know about when stopping your medication is that you're going to want to do this slowly and gradually. Studies have been conducted looking at the differences between discontinuing medications over time versus stopping them abruptly. And it was found that tapering medications for up to 14 days demonstrated no improvement or minimal improvement in withdrawal symptom severity when compared to abrupt discontinuation. What this means is basically that a 2-week taper is no better than a 3-day taper in preventing withdrawal symptoms. Neither approach is long enough. So when you come off of your medication, you're going to want to do this over the course of months to prevent withdrawal symptoms from popping up. And most patients take somewhere between 3 months to even a couple of years to completely get off of their meds. And don't forget, the shorter the half-life of the medication, the more important it is that this rule is followed. So medications like Prozac, which has a long half-life, can generally be discontinued quicker than medications like Paxil or Effexor, which are notorious for having shorter half-lives. Before we dive into the second strategy, make sure to check out the link below if you want to download my free antidepressant beginner's guide, because in this, I answer your most common medication questions in addition to breaking down the pros and cons of the top 10 antidepressants that are currently being prescribed today. So if you're looking to feel better faster, this is definitely something you'll want to take a look at. The second strategy that you need to know about has to do with how to reduce the dose of your medication. And there are 2 different approaches that doctors often take. The most common is a linear dose reduction. So an example of this would be when we're trying to get someone off of, let's say, 200 milligrams of Zoloft. We decrease the dose by the same milligram amount with each dose reduction. So if we're reducing Zoloft by 50 milligrams each time, we would go from 200 milligrams to 150 to 100 to 50 to nothing, right? Makes sense. The problem is that not all people tolerate this type of a medication taper. Instead, something to consider trying is a hyperbolic dose reduction. With this approach, the dose is decreased by the same percentage over time, right? This is different from the linear dose reduction where we decrease by the same fixed milligram amount over time. So for a medication, if the dose is reduced by 20% the first time, you then reduce it further by another 20% the following time, and then so on and so on. So what you see is that the total overall dose from a milligram perspective gets smaller and smaller with each dose reduction. So what percentage dose reduction wise should we be aiming for? If you're someone who is at lower risk for withdrawal, we can start by decreasing the dose by around 20 to 25% with each medication change until we get to 0. However, if you're someone who is at higher risk for withdrawal symptoms, or someone who doesn't tolerate reducing the dose by 20 to 25%, you're going to want to decrease the dose more gradually and slowly. And it's been suggested instead that the dose be decreased by around 5 to 10% with each reduction. Now, an issue that you're going to run into with this approach is that these medications don't come in tablet or capsule formulations that support these unconventional doses. So what we'll do instead is prescribe the liquid formulation of your antidepressant. And if your antidepressant isn't one that comes in a liquid formulation, liquids will have to be compounded by a compounding pharmacy. The third strategy to help prevent withdrawal symptoms is to switch your current antidepressant to a different one that has a longer half-life. It's not uncommon for some people to really struggle with even the smallest dose changes of their antidepressants, and this is typically seen with medications that have a shorter half-life. What we'll do is switch you over to an equivalent dose of something like Prozac, right, which is notorious for having a longer half-life and with being associated with lower incidences of discontinuation symptoms. And this switch can be done relatively quickly and without much of a delay. Then what we'll do is we'll work to gradually reduce the dose of Prozac until it's completely out of your system. If you're still thinking about trying to get off of your antidepressant, make sure to talk to your doctor about which of these strategies would work best for you. Now make sure to hit that subscribe button and then head on over to that next video to learn more ways that you can feel better faster.